What's going on? My name is Dan. I'm a doctor of physical therapy, and it's my goal to explain all kinds of anatomy and pain in simple English. Because everybody has a body, so you deserve to understand it. Today we're going over the rotator cuff. The rotator cuff is actually made up of a group of 4 muscles. 3 of those muscles lie on the back of the shoulder blade, and 1 of those muscles lies on the inside of the shoulder blade. On the back of the shoulder blade, we have the supraspinatus, the infraspinatus, and the teres minor. On the inside of the shoulder blade, we have the subscapularis. The major motion of the 3 muscles on the back of the shoulder blade is external rotation, which looks like this. The main muscle function of the subscapularis on the inside of the shoulder blade is internal rotation, which looks like this. But even though those are the movements that the muscles make when in isolation, the actual function of the rotator cuff is all 4 of those muscles working together to work as what we call a shunt muscle. Basically, when all 4 of these muscles contract together, they hold the shoulder joint stable. And that's what allows the shoulder to glide smoothly when going through movements like reaching across the body, reaching over your head, or even reaching behind your back. So when there's something wrong with the rotator cuff, the shoulder joint itself will feel loose because there's nothing holding it stable. And that's why you can expect to see some of these symptoms when there's something going on with the rotator cuff. Some main symptoms of a rotator cuff issue are when you're raising your arm, you might feel some popping or clicking. You might even experience something we call a painful arc, where as you go to lift your arm, there's no pain. Once you get it to right about here, the pain kicks in. Once you get it above here, there's no more pain again. But then once you get it up here, there's another little bit of pain at the top. You also might just experience general looseness and weakness, or pain when reaching across the body or behind the back, because those 2 movements put the rotator cuff on stretch. So now that we've discussed anatomy and the symptoms when that anatomy goes kind of haywire, let's talk about what we do for treatment. When treating the rotator cuff in physical therapy, it really doesn't matter if there's a small tear or a tendonitis, or if the rotator cuff is just weak or inactive. Treatment will always revolve around taking away pain and then reactivating the rotator cuff in a comfortable way, and then progressing to get the rotator cuff functional again so it can hold the shoulder joint stable when you have to do whatever it is you have to do. The goal when trying to take away pain caused by the rotator cuff is to try to take away some of the tension that's in the rotator cuff due to the injury. To have patients do this at home, a lot of times I'll have them roll out the rotator cuff muscles with a lacrosse ball on the wall, or do something simple like a sleeper stretch or a behind the back stretch. The goal is to keep both of these very gentle, and when you're done, you should feel better than when you started. If after rolling out or if after stretching you find that the shoulder is in more pain, it just means you're pushing it way too hard and you need to back off a little bit. Once some of the tension has been taken away, then the goal becomes to activate the rotator cuff again. If it's really weak, we'll start with something like an isometric exercise where you just push out against the wall, and progress that into doing maybe a full external rotation movement with a resistance band. Once we can isolate and activate the rotator cuff muscle comfortably, then we start to build into some more complex exercises to really work the rotator cuff how it's meant to be used. To do this, we try to activate the rotator cuff while putting the shoulder through a full range of motion. This starts to retrain the rotator cuff how to hold the shoulder joint stable again while challenging it with different movements. And while you can certainly try to apply a lot of these principles at home, if pain is only worsening and it's not getting better, please see a physical therapist in person. That way we can find out exactly where that pain is coming from, exactly why the rotator cuff got hurt in the first place, and we can tailor an exercise program exactly to your needs. And if this video helped you in any way, please do me a huge favor and hit that subscribe button. Okay, so now that we've gone over all the principles, let's see what it looks like when it all comes together for an example session. So, like I said, I like starting with the lacrosse ball to loosen up the muscle and prepare the muscle to be worked out. When using the lacrosse ball against the wall, you want to make sure that you're using a nice, gentle pressure. Target areas of tightness and use a pressure that will consistently feel better the longer you go. Alternatively, you can also try to stretch the rotator cuff with something like this, which is called the sleeper stretch. Again, being very gentle, making sure it feels better the more you go. Or you can also replicate the sleeper stretch in this seated position with your hand behind your back. When it's time to start working the rotator cuff, you got to start in a place that is right for you. If it's very painful, you might need to start with a simple exercise where you push against the wall before progressing into something like isolated external rotation with a resistance band. You can only start to progress to more complex exercises once you're able to fully control and do comfortably the isolated movements. Then you can start locking yourself into a position and moving the arm up and down in a complicated range of motion as you can see here. These are of course just a few examples, but in reality there are close to 100 different great exercises you can use to build the rotator cuff. Make sure you subscribe because in another post I'll go over specific exercises.